So now we're set up for the procedure. We've had the patient come into the room, we've set them up on the monitor, and we've gotten their vitals. We're going to discuss consent now. So for every sedation case, we should have 2 forms of consent. And once we're finished filling them out and discussing them with the patient, we're going to put them here on the wall so that they can be reviewed and signed by the surgeon. So the first consent we should have is the oral surgery informed consent. That's the basic consent form for the procedure itself. It has a front and a back side. We've discussed filling that out in a separate video. The second consent form we should have is an anesthesia agreement and consent. And we'll discuss this as well and how to discuss this with patients and fill it out in just a minute. So once those are filled out, the patient's image should also be placed up on the screen. And at the end of the procedure, we need to be cognizant of the fact that we shouldn't leave images of the patient on the screen for when other patients come into the room. We want to be HIPAA compliant, and we want to be sensitive to the fact that we have patients' personal information. So once a patient is finished with their procedure, we make sure that the screen is emptied of their information so that other patients won't see it. And that is the basic setup and consent setup for a procedure. And now we'll talk about anesthesia agreement and consent in a separate video.